Hi, this is Dr. Padda, and I wanted to talk a little bit about the use of sauna. We frequently recommend heat therapy for our patients when we're trying to deal with issues of severe pain. And a lot of times I get the question over and over again, why are you interested in us having heat therapy? And I want to talk a little bit about the role of heat therapy and what it actually does. So the simple thing is that when you're in a sauna, you will get some dopamine release. And dopamine is the thing that triggers the sensation of pleasure. And so if you have a ton of pain and you get some dopamine release, very akin to as if I had given you a pain medication, you'll get some improvement in symptom. There's also an effect from the sauna because you're sweating. And as you sweat, you lose a lot of sodium, you lose a lot of other electrolytes, and patients that frequently have a lot of pain have very high cortisols. And when they have a high cortisol, they retain a ton of sodium, they start to swell. And the sauna certainly affects their sweating and allows them to bring their blood pressure down, lose some of the sodium. There's another effect of sauna, and this is on volatile organic compounds and on other agents in our body that might cause us mischief. What I mean by that is that there is a possibility that if you have incredible amounts of toxicities or have been exposed to long periods of time with volatile organic compounds that we sometimes will find in our household, and that's affecting your pain, the sauna will help you kind of detoxify that. It'll especially pull materials that are resident in your fat-soluble pieces of compounds that you want to get out of your body. So there's a detoxification effect. There's also an effect on insulin resistance. Now keep in mind that insulin is the hormone that takes your sugar in your bloodstream, and that sugar is pulled into the cells. And if you become insulin resistant, you produce too much insulin over a period of time, then you end up with an issue that you're pre-diabetic or diabetic. And there's a direct effect on heat therapy and insulin resistance. And so these are all relevant things, but there are other effects. There's something called heat shock protein 9 that occurs when you do about 20 minutes of sauna plus. And when you get to that level, your body kind of feels like, hey, I don't feel good. I feel a little bit uncomfortable at this point. That's called a hormetic response, Hormesis. It's hormesis. It's that which doesn't kill you, only makes you stronger. It causes a tremendous amount of growth hormone release, and that's beneficial because the growth hormone prevents you from something called sarcopenic wasting. Sarcopenic wasting is when you start to lose your muscle mass because you're not mobile, or that you hurt when you're mobile and you can't exercise a certain area. Well, this creates growth hormone release from sauna usage, and that helps restore some of your muscle mass. There's another effect on something called non-alcoholic fatty liver disease. As patients consume too much carbohydrate, they store a lot of fat because of the insulin in their liver. And about 2/3 of the patients that we see have significant non-alcoholic fatty liver disease. And one of the easiest ways to reduce non-alcoholic fatty liver disease is certainly to stop eating the carbohydrates. But the other thing is to mobilize that fat. And that can be done through increasing their metabolism using heat. There's also another effect on something called metabolic inflammation. When you have a tremendous inflammatory load and everything hurts and your reactive oxidase system is not working right, the heat affects your mitochondria to produce melatonin. There's an infrared effect to that. And when you produce melatonin inside your mitochondria, that's a free radical scavenger. So there's a direct anti-inflammatory effect of metabolic inflammation. There's an additional benefit. This sauna therapy is equivalent to doing exercise. So if you do sauna therapy 5 or 6 times a week, it's the equivalent of doing some significant aerobic exercise. And in fact, there's been studies done that show that people that just do sauna alone are getting the same effect as exercise. And with that comes an improvement in heart disease. It lowers your cardiovascular risk profile, and it probably with the combination of all of this going on, it decreases the risk of clotting in your blood. It decreases the stickiness of your blood. There's another benefit, that it helps degenerative osteoarthritis. Patients that don't have adequate exercise, patients that have a lot of cartilaginous loss, they're not moving their joints, they can't do what they need to do. This sauna therapy allows them to maintain their muscle mass and improve the function around the degenerative arthritis, and it makes them feel better. There's yet another benefit, and that's in patients with severe migraneous headache or chronic sinusitis or aero allergies. A lot of people have aero allergies, and we find that sauna benefits them because it changes the mucus thickness in their sinuses and allows better drainage. It also decreases their sensitivity to airborne allergies. We also use heat therapy in a whole host of other things, and I want to mention the difference between different kinds of heat therapy. There's certainly the infrared therapy, which is the red lights that you see, and then there's moist sauna. Both of them are good, but the key element is time and actual heat generation, and how hot your body's getting and how much sweat you're doing. We customize our protocols to every single patient. So we don't just say, oh, go do this, and everybody's the same. So I'm giving general information here because I get the questions so often, why is this important? But what we're going to do is, when we actually talk to you in person and we discuss this as a portion of your overall treatment, then we're going to idealize this so we all understand where we're headed. If you have any questions, please feel free to reach out to me, and I'd love to chat and we can discuss further. But if I've referred you over to this video, this is just for some backup additional information. Thanks so much.